Welcome back to the Health Chat. I'm Dr. Greg Eckel.
I'm Dr. Greg Nye.
And we have our annual talk about colds and flus. It's that time of year again.
It certainly is.
Yes.
There's a lot of sick people coming in.
A lot of sneezing, a lot of coughing in the clinic these days. And we even get the calls saying, I'm just too sick to come into the office. Which, it's like, well, that's why we're here. That's what we do.
It's very thoughtful that people think, oh, they don't want to make us
share
sick,
these
but
germs. Right.
Yeah.
We do get exposed to quite a few things around here. And so what I would like to do is just share with you what we personally do during cold and flus for ourselves and our families and for our patient base. Recently wrote an article in the newsletter, and you can find that on our website. We also have a lot of resources on this topic because...
What is that website?
That website is naturecuresclinic.com.
Good.
Yeah, and so we will also have a discussion going on Facebook shortly, our Facebook page. You can look us up there if you're not part of that community or discussion, and we're going to be talking about the flu vaccine in particular with any questions that you may have. So it'll be driven by you, so you got to participate or there won't be any replies. Talking this one through, of course, we will start out with the big gun, which is vitamin D. Again, not the end-all, be-all vitamin out there.
Right.
However, when you look at what vitamin D does for you, it activates natural killer cells. And actually, before we even get into that, we'll just lay out what we will talk about today. And it's really about, there's a preventative component to cold and flu season. Then there's, what if you get the cold or a flu? How do we limit and make it less severe for you? And then, why are we doing natural products rather than over-the-counter and suppressive agents? And really, I'll give you the punchline on that, is we want to increase your vitality so that you are less apt to get sick in the future. So I remember, early on in my career, I would get a cold, or, in 2000 I got that rabid flu. That was a tough one.
I think I did too.
And it was a great high fever, and I haven't had another one since, but it doesn't mean that you never get sick, right? So I think those folks that come in and say, I haven't been sick for 30 years, I actually get a little bit worried about that, in that they're not able to mount, you're not able to mount a response to other. And the way our immune systems function, it is healthy to get sick every once in a while, just not deeply sick. And it could be just the sniffles or a cough or a little runny nose, but you're challenged. You haven't seen every virus on the planet. Right. There's no way. And so...
Yeah. I remember someone once told me that a good definition of health is the ability to move into and out of disease with ease.
Yeah, I love that definition.
Which I think it's a great definition. Being healthy doesn't mean you never get sick. It simply means that you're able to be sick, let your body do what it needs to do, and then it's over. It resolves, and you don't stay in that state. And I really like that.
That's great, because it really touches on, just one more component on this aspect is the suppressive therapies of the over-counters. They, when people say, oh, I took Tylenol right away, I got that fever down, like as if that's a healthy way to treat a cold or the flu.
Yeah.
Where we actually promote keeping the fever going as long as possible, because that's the cure of your body.
There's a reason for the fever.
Right. The fever is the cure. And when you suppress your innate immune system or your ability to overcome it sends the wrong signal to your body to not heal itself. Right. And suppression after suppression after suppression leads people into deeper and deeper sickness. And we see it all the time here. Where, with kids respond so beautifully to natural products because they have not been suppressed their whole lives. Adults, 5th, 6th, 7th decade, it takes a lot more oomph to get the body to respond to what we're doing, because it just has forgotten how to respond.
Yeah, kids can get a fever of 103 in 30 minutes. Yeah. And if an adult can get a fever of 101 like that's really sick for an adult. Yeah. Whereas for a kid, they could, with 101,
and then they're happy the next day. Right. Yeah. And then it's gone and they're healthy. Now, it's not to belittle or to say, well, sometimes it doesn't turn serious, or you really have to watch it. You have to be under somebody's care, I would recommend, because, it's a little bit different for our families because we're there and we understand what's going on. But if you don't have a doctor in the family, a naturopathic doc in the family, then, what do you do? Well, you can call us is what you can do, or get a naturopathic doctor in your camp with you so that you have some supervision. You know where to draw the line as far as what's an acceptable amount of illness. Now, and that's not to say we're not promoting suffering. A lot of times I'll hear that too. But, all right, so I'll get off of that topic. Well,
no, it's a good topic.
Yeah, it is. So moving into, what do we do? I mean, as far as, first signs, so we're getting sneezed on, coughed on, people kind of snotty in their hands, touching everything around here. I'm not an incessant, I definitely wash my hands, right? That's public health
all the time
motto, wash your hands.
Of course.
I definitely do that. I'm not putting my hands in my face or in my eyes or in my ears, in my mouth, that's just don't do that. Right? Training the kids, cough into your elbow, don't just cough into your hands or cough into the environment. I mean, there's just simple things like that. Vitamin D, which we started out, so we're coming back around.
Thinking about the things that people want to take in excess. I mean, ideally, the things that we're about to talk about are started as soon as someone has that feeling like, I'm getting a little something. That feeling in your bones where something's coming on. That's the time to start.
Those first couple sneezes.
Not wait, and especially if someone has that feeling, that's the wrong time to be going out for a big dinner or, I'll just go to
I'm getting dessert tonight.
That's the wrong time. That's the time to really hit it hard with vitamin D, the things that stimulate antiviral, antimicrobial immunity. In the conventional world, they have several antibacterials, antibiotics. They have relatively few antivirals.
Very few.
And essentially antivirals are not given in situations of cold and flu. They're really given for things like herpes virus infection or those sort of things where they use the big guns or the antivirals. In our world, there's really no differentiation. There are essentially no nutrients that have antibacterial effect that are not also antiviral. They're just anti-microbe or anti-bug or however you want to think about that. So, for instance, vitamin D. It activates antiviral immunity. But it also activates antibacterial immunity. It's all kind of part of the same package.
It's activating your immune system.
It's the same thing. So, again, we're checking levels. We want to make sure people have adequate amounts. And in times of infection, and especially really significant infections, we may be ramping up doses really high for a short period of time. There's a window of safety with that we want to stay within.
Exactly. You hear a lot of creed given to the toxicity of the fat-soluble vitamins like vitamin D, and I've just found clinically that it's you don't have to be as cautious. Yes, of course, you want to consider that because it is a fat-soluble vitamin, but levels of toxicity we have not seen in the clinic.
And actually, the studies show that with vitamin D in particular, vitamin A is different. It really can be toxic at high levels, and people get symptomatic. With vitamin D, you actually have to take about 1 million international units a day for about 3 months before you start manifesting toxicity. I don't recommend anyone push that envelope, but the point is that at the levels that we're talking about, there's essentially no evidence that it actually causes toxicity. There's a lot of theoretical
concern,
discussion around that, but in the studies that have been done, no one is seeing it happen.
Another great thing that you don't have to take at all, but it's on a home hydrotherapy component, is what I like to recommend is wet sock treatment. It sounds odd, but it is very effective.
It's very effective.
It's very effective. Real quick, in a nutshell, it's 2 pairs of socks, white cotton and wool. You take a hot foot bath at nighttime. You put the white socks underneath the spigot as cold as it'll go. Wring them out so that they're damp, not dripping. Put those directly on your feet. Pull the wool socks over that. Go directly to bed. Do not pass go.
Right.
So that's it in a nutshell. Do that for the first couple nights that you're feeling ill. It will clear your head. It'll help your throat. So anything basically from throat up, that's a great home remedy that doesn't cost you anything, just but a little bit of your time. You actually will sleep deeper. I've had good reports of that, and it really does help increase your circulation at a time when your circulation slows down.
Yeah, it's a really great therapy.
Yeah.
And in fact, one of the things that I'll often recommend for people is just to do a nice Epsom salt bath as a way of warming their feet up, but their whole body is in a good Epsom salt bath, and then you're completely relaxed by the magnesium, which is in the Epsom salt, and then
do the rest of that.
Do the rest of that. Quickly we can run through some other things that we're thinking about.
I really my go-to personally is a product called EHB, and I don't like to plug products so much, but this one has been just great year in and year out, and it's Echinacea hydrastis and berberine. In addition, it has garlic, it has a little bit of vitamin A, it has some other immune-enhancing, it has some mushrooms in there. It is anything, when you have congestion or anything going on in the sinuses, it will dry you out, and it really helps get you out.
Vitamin C, I often recommend 2 grams every 2 to 3 hours for somebody who is really going through, they got the funk going on. And you mentioned garlic, neti pots, with some probiotics in them for people that have sinus
I'm glad you brought the probiotics up. I think that's a really novel approach for cold and flu. A lot of people forget 90% of your immune system is surrounding your gut and the gut-associated lymphoid tissue, and so by doing a great probiotic, you can do the neti pot and internally. It's another great one that we do. A little bit different flavor today. Where we don't tend to give a lot of treatment options out here. We're not recommending these treatments for you. We're just saying these are the things that we kind of use personally for ourselves and our families. But we do find them to be really effective. You can check them out on our store on the website as well. We put them up there for you to share with those that are listening to us. So again, thanks again for listening. Check out our website at naturecuresclinic.com. And we also want to, request some questions again. We're going to get back into the flow here. We've got it on our schedule. We're going to be filming on a regular basis again. So
send those.
Questions at naturecuresclinic.com. Thanks.
Thanks for joining.